Good evening, friends. Today is World Asthma Day. As we talked about it earlier, the first Tuesday of May is always remembered as World Asthma Day. We mentioned earlier that asthma is a very chronic problem. It's a very compelling issue. It's a very democratic disease. It affects all age groups. It affects all socio-economic groups. It breaks the racial barriers, political barriers, geopolitical barriers. It's a very huge, it's a profoundly important problem that we need to address. This year, the World Asthma Day, the take-home message, it says, closing the gaps in asthma care. I think that's what it says here, closing the gaps in asthma care. To me, it sounds more like a euphemism, something that doesn't sound very pleasant. We want to sugarcoat and present in a more acceptable, in a more pleasant way so we can hear slightly more encouraging words. To me, it's not just closing the gaps in asthma care. It's more like addressing all the big lacunae, big vacuums in asthma care, and filling up the big holes in asthma care. It's not gaps, it's not small gap. If it's a gap, it's a very big gap. That's what I want to stress on. Kindly don't take me as a cynic when I say such things. This is born out of experience over the last 40 years taking care of asthma patients. Very young ones, very old ones, very sick ones, very mild ones. Very, very compliant population who comes for regular follow-up, and very non-compliant population. And poor perceptors who don't understand that they have a serious asthma problem, and heightened perceptors with even small variations in their peak flow, a little bit out of control, they feel an exaggerated awareness towards their asthma problem, heightened perceptors. So all these things are there, but I will just give like one-liners about the gaps, the perceived gaps in asthma care. Number one, the diagnosis. If there are 100 patients with asthma in a given population, we have to realize hardly 3 or 4 get picked up as asthma. Especially in pediatric population, those children who present with cough but no significant wheeze, what we call a cough variant asthma, they never get diagnosed as asthmatics. They are treated as a case of cough, bronchitis or just allergies, but they are never given a diagnostic label, bronchial asthma. So there's a big gap in the diagnosis. Even on children, even in adults. Coming back to children, yeah, many of them are even labeled as primary complex, which has got really no relationship and no semblance to bronchial asthma. Primary complex presents as either a fever, a low-grade fever, long duration, loss of appetite, poor weight gain, failure to thrive, those symptoms. But never a cold or a cough is a presenting symptom in primary complex. I always tell, primarily it's a complex in the mind of the doctors who make the diagnosis of primary complex. So in adult population also, most of the time I see that asthma is not the diagnostic label. When I see patients who have been having trouble over the last 10 years, 20 years, they are not properly diagnosed as asthmatics. They were never given a PFT test to assess exactly what kind of a airway problem they have. So this is a diagnostic gap, and once the diagnosis is made with proper history, proper family history, proper PFT assessment and other things, how many people actually get proper treatment? If there are 10 asthmatics who are diagnosed, I think 2 or 3 only go on proper treatment. When I say proper treatment, I mean going on a proper preventive treatment. Just taking salbutamol inhaler or salbutamol nebulizer as and when they get a flare-up is not asthma treatment. Having a nebulizer at home and getting the nebulizer treatment whenever there was issues like with wheezing, that is not asthma treatment, and most people do that. I totally disagree with that. I always tell them a nebulizer is an emergency treatment. It is not a regular treatment. If you're traveling in a bus, you have a regular entry and exit in a bus. You also have an emergency exit. In case of accidents or emergencies, you break that and then get out of the bus just to escape from getting trapped inside. The same way, nebulizer should come handy in case of emergency situations, acute flare-up of wheeze. But that should not be maintained as a regular treatment. So there are some gaps in the treatment. And there are a lot of gaps in the follow-up. Patients, when they feel better, they drop out and they don't come to you. And after several years, when they have the next flare-up, they come to you. And there is a gap in asthma education. The asthma education should start on a grassroots level. General public should know what this disease means. General practitioners should know. All the medical practitioners should know how to approach a child with asthma, adult with asthma symptoms, and put them on proper treatment, or refer to a specialist when there is a need for that. So, when you are talking about closing the gaps in asthma care, we have to close the big gaps in diagnosis, proper management, proper follow-up, and proper education of the society, of all the primary care doctors, the grassroots level education I mean. We all have to realize asthma is an extremely common problem. It's widely underdiagnosed, very badly undertreated, and there is a stigma that comes with asthma. So most doctors don't want to give a diagnostic label bronchial asthma. They say allergic bronchitis, wheezy bronchitis, eosinophilic bronchitis, all kinds of things, but not bronchial asthma. Let us call a spade a spade. Only then you can actually put them on proper treatment. Long time back, when I was in USA, like in 80s, the Newsweek had a cover story which said, not labeling a child with asthma as an asthmatic is a systematic conspiracy against children. You have to realize that. You don't want to subject children to poor asthma care and let them suffer needlessly. So, the message today on World Asthma Day is, let us all understand and accept that asthma is a label that you can take in peacefully, accept it gracefully, and have the doctor to treat you on a long term with proper inhalers and receive proper education about asthma and allergies and things like that. Let us control asthma and let us not let asthma control our life, your life. Thank you. Appreciate it.